Hi, everyone. I'm Jess Chu, a Vice President of Marketing here at Trella Health. And today we are talking targeting strategies. I'm joined by Teresa.
Hi, I'm Teresa Buglione, Director of Services at Trella Health.
Thanks, Teresa. So we were going to talk about unaffiliated today.
Yes.
What is unaffiliated? Tell me more about this.
So when we're talking about physician targeting strategies, unaffiliated means that those physicians, when you're looking at them, they have a large number of patients that are using some home health and hospice services. But when you look at the destinations, they don't have a strong affiliation to any one preferred provider. You'll see that there is a large number of providers with very small numbers where they don't have that strong market share or that preferred provider where they're sending their patients to only. So it comes across as if there's an opportunity that any agency can go in and work and build a partnership and strengthen a partnership with those providers to become their preferred provider. So they don't have a strong affiliation. Sometimes I think it's because some agencies may offer services that others don't. Or again, as we talked about in another segment, physicians may not know all the services that you provide. So they may only know that this agency has infusion or that agency does wound care, not knowing that your agency provides all.
How common is this? Does this happen often with physicians not really having a strong affiliation?
I'd say about 30% of the physicians in most areas, from what I've seen, do come across when you're looking at the data as not affiliated to any one specific agency.
That's actually surprising.
It's a huge opportunity where you can showcase who you are. What are the key areas and what are the services that you can provide? Talking with them and finding what do they need for their patients. I've said this over and over. Ask those questions. Why are you sending your patients to all these different areas? What are the needs of the patients that you're servicing? So that way we can help you with that.
Yeah, I think that's great. And I like how you said, make sure they know what you offer. Because I think that's something people may take for granted is, oh, well, it's on my website. It's on my flyers. It's pretty clear what I offer.
That is true. So what happens sometimes when an agency starts off, they may start off only servicing a small cohort of patients and they grow over time, either by areas in which they serve patients, they hire more clinicians to be in different territories. They may expand the amount of services they offer where they did wound care. Now they have infusion. Now we also have pharmacy services. And sometimes they assume that these physicians know, like you said, it's on their website. They've been in the area for many, many years, and they don't always do a good job of saying, this is who we are, and we've expanded on everything that we're offering. Here are the clinical programs that we have. So it's really important to really push that on a regular basis.
And are there specific metrics that physicians who fall into this category may find particularly compelling?
There's several. So with an unaffiliated provider, I always say take a look at who the provider is. Look at that physician, find out what's important to them. Again, what type of patients are they servicing? Then take a look at your agency and see how can you better serve them. Are you doing a good job with readmission rates? Are you able to provide more clinical nurse to therapy visits? Do you get your start of care or provide services after discharge within the 48 hours? I have a niche in endocrine and I see he has a large endocrine population and he's sending patients all over. We do outlier patients where we have clinicians that can go out 3 times a day to help those patients who are discharged when they need help when they're first learning how to manage diabetes. So all of those things, you have to look again at that physician and then tick and tie to who you are as an agency, find that niche, and then build your presentation and your data based off that metric that's important to them and then present.
Well, that was really informative on unaffiliated. Thank you, Teresa.
Thank you.
And if you're watching and you have questions about what we just talked about, or you have a different strategy you'd like to see us talk about, feel free to email. It's jess@trellahealth.com. Thanks, everybody.
Bye, guys.